Hey everyone, Dr. Alex Ritza here. We've got another short one for you today, and today we're going to be talking about shoulder blade pain, which is one of the most common things that we see in our office amongst new patients because I have a couple of videos with a few 100,000 views. We attract more people, we see more cases, we help more people, we get more referrals. That's how it goes. So with pain under the shoulder blade, in most cases, especially if it's chronic, especially if it's not relieved by massage and stretching, it's probably from a joint, it's probably from the costovertebral joint, or many of them. Now, these rib joints, when irritated, when shifted, can be very painful, and you can have a whole lot of collateral damage from them if they go untreated. So as an example, one of our blogs, we talked about a patient who presented to the emergency room with chest pain because they'd had this rib joint pain for so long, and in his case, it shot through the front of his chest and was interpreted as a heart attack. But after a few months of care, that pain went away right away, but after a few months of care, he was back to normal. And so I'm working on a new video that's going to talk about this rib joint pain and how we approach it in the office. But something that's really important if you're suffering from this is knowing that in a lot of cases, if not all the cases we see in the office, it is invariably linked to the neck. And so in our office, we always talk about core problem, collateral damage, and where sometimes these rib joints have shifted because they are collateral damage to a problem in the spine. Or if they are the underlying core problem, you can have a lot of compensation or collateral damage that spreads out from underneath the shoulder blade from those rib joints. One of the things that we see most often is a lot of hypertonicity or tightness in the scalene muscles in the side of the neck. Now, this is important for a couple of reasons. Number one, the dorsal scapular nerve travels from this part of the neck around C4, C5, and goes along that inside border of the shoulder blade from here in the neck down the shoulder blade, and it turns on a lot of muscles on that side of the shoulder blade, the rhomboids, the levator scapulae. And if it's irritated, it's going to cause some weakness in those muscles, making the function of that rib cage and the shoulder blade worse. Another really important thing is if you type into Google or you look at the thumbnail for this video, you type in scalene muscle referral. And referral or trigger point from the scalenes, one of the trigger points from the scalenes, which is when you have a really, really tight band of muscle within a muscle, and if you press on it, you will get some traveling pain or referral away from the muscle. And one of the referral points for the scalenes, especially the anterior scalene, is right along the inside border of the shoulder blade. And so in our examination, I always check this area of the spine. And if we find that there is numbness and tingling or pain referral or weakness as a consequence of these muscles, joints, nerves in the spine, then that's something that has to be addressed if you want this issue to go away. If your chiropractor is just continuing to adjust and adjust and adjust that joint and it doesn't fix it, then they need to be looking elsewhere towards the neck and other parts of the body that might be connected, that might be either compensation that needs to go away or the actual underlying cause. So when we approach this cases in our office, we always make sure that with making sure the spine gets healthy, that these scalene muscles relax, and that those trigger points and any irritation in the side of the neck here goes away. You can do that by either making corrections or adjusting the neck, doing some soft tissue work in here, or in some cases, you actually have to go in our office and we'll actually put needles into these muscles with some electricity. It's very safe. It's just very, very, very intense. And when we do that, you can get these muscles to calm down, to relax. And often that is a necessary step to help these cases to make sure that the spine is healthy and make sure that those rib joints start to function better and that the pain in the area goes away. One last point. In these cases, which I'll do another video on, it's really, really important to focus on belly breathing or to make sure that the patient can breathe with their belly so that they're not using their scalenes to lift the rib cage 10, 20, 5,000 times a day with each breath, really tightening up these muscles here and aggravating potentially the ribs, creating a lot of tension. So you'll see a couple links below in the comments well, not in the comments, in the description. One of them is for a stretch I'm going to show in a second, which we've done a bunch on this channel. Another one is a link to how to learn how to belly breathe. This is something where if there's hands-on help that you can get, very helpful. The video should be very good though. It's an oldie, but a goodie. My hair looks better. So the stretch I'm going to go over in the Instagram post that's connected, it's called the chair stretch. This is one of the best stretches for the scalenes, where we grab onto the chair, do not move your neck, lean your body, you take all the slack out of the way, and then you lean your neck over. Nice easy breaths with the belly. Deepen the stretch a little bit. And we would hold that for anywhere from 20 seconds up to 40 or 60 seconds. Really important when you're leaning the body not to leave the neck. Take the slack out. That will stretch the scalenes and make sure they're not getting tighter and tighter and tighter by working on your belly breathing. So if you're seeing somebody for this, make sure that they are addressing the neck and the scalene muscles in the neck. If you're not seeing somebody for this, go see someone. If you're trying to do it yourself approach, use the links I gave you guys below for free. And then if you're looking for somebody to help you with this, make sure that they look at the spine as a whole, make sure that they address your neck, make sure those scalene muscles, make sure the neck is not a cause or a contributor to that shoulder blade pain. So guys, that's what I got for you. That is my big secret. That's how we have success with these cases in the office, because we make sure we just don't focus on where the pain is. Sometimes that works. Most of the time it doesn't. Anyways, Dr. Alex signing off, guys. I hope you take very much. That was a bad sign off. I hope you take care, be well, and I'll see you soon.